Laser hair removal has been an effective way to remove hair permanently for a couple of decades. Quite honestly, it almost seems silly that people still shave their bikini or their legs, not to mention their face. On average, our patients have 80% of unwanted hair completely gone after 5 treatments. It gets rid of all of it. No more waxing, shaving, or painful ingrown hairs. And laser hair removal is generally pretty affordable, so why use razors and shaving cream on an everyday basis? As with anything, you do get what you pay for, and that's certainly true with lasers. There are many different types, and unfortunately, some of them just aren't very effective. At Cosmetic Skin and Laser Center, we use the LightShear Duet laser, and it's truly a step ahead in terms of effective permanent hair reduction. The ideal patient has dark hair and light skin, and they've stopped temporary hair removal treatments such as tweezing or waxing for 4 to 6 weeks prior to treatment. Shaving's always fine, just no removal from the root of the hair. And ideally you're not tan. We can treat light hair and tan patients, and we can even treat people who have been tweezing or waxing recently. But it might take a few more treatments to achieve the desired result. The one thing no laser works on is white or gray hair. Trust us, we've tried. We always get the question, is laser hair removal really permanent? And the answer is yes, of course it is. Once the laser destroys the hair follicle, the hair never grows back. The problem is that new ones can grow. Hormonal changes like menopause or pregnancy or discontinuing birth control, even plain old aging can stimulate new hair growth. Most of our patients come in for maintenance or touch-up treatments about once a year for body hair and a couple times a year for facial hair. The second most common question, does it hurt? We'd never lie and tell you it doesn't hurt. But with numbing cream and our new high-speed Duet laser, discomfort is generally minimal and treatments are really tolerable. Honestly, most patients just use ice. Each pulse of the laser gives kind of a pinching hot sensation that goes away literally in just a second. And although it's possible to get a blister from a treatment, we've only seen a handful in like 15 or 20 years. 99% of the time, patients are a little pink when they leave, and the area might feel like a sunburn for about an hour. Laser hair removal treatments are generally spaced 4 weeks apart for face and 2 to 4 months for body. This is to effectively destroy the follicle at all stages of growth. Treatments can take anywhere from 5 minutes to an hour and cost $75 and up. It just depends on the area. Shaving is always completely fine, but to get the best results, don't tweeze or wax between treatments. I know what you're thinking. Shaving will make my hair get worse on my face. That is a total myth. It's just that hair gets worse as you age. So people naturally blame the razor. It's simply trimming the hair. We'd all have tree trunks growing out of our heads if trimming made hair grow back thicker. And just think, you only have to do it until you complete your treatments. Some medications can make certain patients more sensitive to laser treatments, so we'll go over a list of your medications prior to each treatment. And please be sure to let us know if you come in and you're on a new medication or an antibiotic, or you've had recent sun exposure. And you better watch out. It's a rare occurrence that someone has laser hair removal done on one area of their body. Once you get rid of hair on your underarms or your bikini area, you're going to want it gone everywhere. All of us at Cosmetic Skin and Laser Center have had laser hair removal. It saves so much time in the morning. Have more questions? Ask away. Our consultations are always complimentary.